morning, everyone. I'm Dr. Anuradha Rao, an ophthalmologist from Kokilaben Hospital, Mumbai. Today, I'm going to tell you the importance of regular eye checkup. Now, the day you are born, it is always ideal to get the eye examined because you can have simple problems like the tear duct which can get blocked to major problems like congenital cataract, glaucoma, and even in premature babies, you can have a condition called retinopathy of prematurity. When the child goes to school, it is ideal to get his or her eye examined for any refractive error. Hence, it is made mandatory in every school where the child gets his eyes checked, and if there is a problem, they refer the child to an ophthalmologist, and ophthalmologist gets a thorough checkup done and prescribes the glasses. Such children need every yearly checkup because when they grow, their eyes also grow and their vision, the refractive error can progress. There is a honeymoon period between 20 to 30 years when most of them do not have much of the problem. They enjoy good eyesight. But then when it comes to 40, you do find it difficult to read. That is when your near point of vision starts receding and you need glasses for reading. This term is called presbyopia. So from 40 onwards, you are going to experience an increase in the number once in every 5 years. Yeah, regular eye checkup is required after the age of 50 because certain conditions like glaucoma, cataract, and diabetes, hypertension can pose a problem in the eye. So, patients with glaucoma definitely require a regular eye checkup. As we all know, 98% of the patients who have glaucoma go undetected because they are not symptomatic. When the patient is examined by a doctor and the doctor diagnoses that you have glaucoma, there is a thorough or a comprehensive eye checkup, including a complete vision check, slit lamp examination, examination of the angle of the chamber using what is called a gonioscope, examination of the intraocular pressure by what is called applanation tonometry. All these tests are also collaborated with other tests like the optic nerve head imaging, perimetry or field of vision examination. All contributes to the diagnosis and further treatment of glaucoma. Now, diabetes is one of the most important causes where you require a regular eye checkup. In diabetes, patients who are diabetic more than 20 years, more than 10 years, definitely present with diabetic retinopathy. And because of the severity of diabetic retinopathy, you may require laser, you may require injection, and hence a regular follow-up. Hypertension also can be diagnosed when looked into the retina. Hypertensive retinopathy sometimes can cause sudden blockage of the blood vessels and it results in what is called branch retinal vein or retinal vein occlusion. This results in sudden loss of vision and needs a regular checkup. Certain children, they present with allergic eye disease where excessive itching and rubbing takes place, and during this condition one needs to be treated with steroids, and long-term steroids use can cause glaucoma, can cause many problems, and hence an ophthalmologist needs to be there to examine the child periodically. Parents are sometimes scared that use of steroids can cause lot of problems, and hence don't treat the child. So what can happen is the child keeps rubbing his eyes, and this results in another condition called keratoconus. So it is a double-edged sword. So a proper treatment has to be given by an ophthalmologist, and hence a regular follow-up is required. Frequency of visits depends on the severity of the case. For example, in the early stages of glaucoma, you need to be seen very frequently so as to bring down your intraocular pressure to a baseline level. And then in mild to moderate glaucoma, maybe 6 monthly to a yearly follow-up, or severe glaucoma, maybe 3 monthly follow-up is needed. In diabetic retinopathy, of course, depends on mild diabetic retinopathy, requires yearly follow-up. Severe diabetic retinopathy needs laser and other treatment wherein frequent follow-up has to be done. So after the age of 60, of course, we all know you can have glaucoma, you can have cataract. You also can develop a condition called macular degeneration, which results in complete loss of central vision. So when the patient has cataract, when the doctor examines you, he or she will explain to you what is the extent of the cataract, whether the patient needs to wait or whether the visual symptoms are significant enough for him to undergo cataract surgery. Following the cataract surgery, again, a regular follow-up is required for some period. So almost all the patients after 50 really need a thorough regular eye checkup. Thank you very much.